Let's understand why the elderly are more vulnerable to lung diseases like pneumonia or worsening asthma. Before we continue, let's break down each of these lung diseases that are so common among the elderly. Moving on to the second disease, pneumonia. You've probably heard of this one more often. It's sometimes called wet lung. Why is it called that? Because that's literally what happens. Imagine the tiny air sacs in our lungs are like millions of mini sponges. Their job is to absorb oxygen from the air. Well, when you get pneumonia, these mini sponges get flooded. Not with regular water, but with fluid or even pus due to an infection. Germs, either bacteria or viruses, attack and throw a party inside our lungs. If the sponges are soaked, how can oxygen pass through and be absorbed? It's difficult, right? That's why the symptoms include a high fever, as the body fights the germs, a cough with thick phlegm, and chest pain with every breath. The difference from COPD is that pneumonia comes on quickly and suddenly, like an uninvited guest who immediately causes chaos. This is not a chronic disease, but an acute infection that needs prompt treatment. In essence, pneumonia is an infection that causes the lungs to flood with fluid, disrupting the process of oxygen absorption. Symptoms can range from mild to severe, depending on the type of germ, your age, and your overall health. Sharp chest pain when you breathe in or cough. A productive cough, with phlegm that may be greenish, yellow, or even bloody. High fever, sweating and chills. Shortness of breath or rapid, shallow breathing. Extreme fatigue and loss of appetite. Confusion or changes in mental awareness, especially in older adults. Nausea, vomiting, or diarrhea. Last one, asthma. Many of us might have been familiar with asthma since childhood. Asthma is a different story. Imagine our airways are like a water hose. For a normal person, the hose is the right size. But for someone with asthma, this hose is sensitive and easily irritated. The slightest trigger, like dust, cat dander, cold air, or even stress, causes the hose to react immediately. The muscles around it tighten, the inner lining swells, and it produces a lot of mucus. The result? The opening of the hose becomes very narrow, like a hose that's being squeezed.